sample of what an adjustment would look like or feel like in our office. A lot of people are quite nervous about having chiropractic adjustments, and at our office we use special instruments to adjust your spine so there is no twisting or turning of your spine and you stay in a very neutral position. The first thing that we're going to do to start off with is check our patient's leg lengths, and that's going to tell us a lot about what's happening with their knees and their hips and their pelvis. So the first thing that I would do would be to check the person's leg lengths, as I already mentioned. So Michelle's legs, the right leg is short and then it's going long. So we're going to come up to the pelvis and we're going to check the pelvis. So we're going to apply some pressure over the pelvic bones. And I'm going to hear a little, call it the popcorn machine when the kids come into the office to have their adjustments. And we adjust specific areas in the pelvis. Then we would move up into the low back area. And we would do an adjustment in this area as well. And then we'll check to see how her legs are doing. So they're definitely leveling out, so that's a good sign. Then we would come up into the mid-back area and we would be checking some of the vertebrae through the mid-back area. The spine should really feel kind of like a wet sponge. It should have some give to it, and if it doesn't, it feels a lot like I tell patients it feels like a 2x4. So it feels hard in this area through here, so I'm going to adjust this area through here and then adjust the rib on the opposite side. When we're checking the neck, we're going to palpate or feel the spine and look for areas of subluxation. And we're going to adjust right along the spine. So again, there's no twisting of Michelle's neck, and she stays in a neutral position. Lastly, we would come back down and make sure that the spine is nice and level, the feet are level. And then I'll have Michelle turn over onto her back. And we'll spend some time gently mobilizing the cervical vertebrae here, and moving the spine, and just making sure that there's no additional pressure to the nervous system up in this area here. There we go. And Michelle is well adjusted.